Welcome back. This is the first week after Christmas back to Westminster, and I'm pretty sure that during this week we will be discussing in Parliament the NHS and the winter pressures that we've seen hospitals up and down the country facing. Having visited the Royal Sussex County locally last week, I've seen firsthand what a fantastic job our local NHS workers have done, and locally both in Brighton but also in Eastbourne where constituents also go. I know that we've not seen the difficult circumstances that many hospitals have up and down the country, and while we've had 11% increase in the number of patients attending accident and emergency, our hospitals both in Brighton and in Eastbourne have been able to cope. And that's really down to the hard work of all the staff in those hospitals. And so I want to thank them for going above and beyond in terms of looking after patients and making sure that they have been seen quickly, they've been admitted when it needs to happen, but also that behind the scenes there's been a lot of work going on to ensure that there's beds available. And when I went to the Royal Sussex County last week, I asked why they were coping, although it was difficult and demanding, why they were coping when many other hospitals weren't. And the answer I got was it was down to a lot of planning and a lot of joint working before the Christmas period. So the Sussex NHS Partnership just before Christmas had announced that by working with the local authority and the hospitals, they'd seen a reduction of about 38% in delayed discharges, which is a fantastic achievement. And what that means is that there are now beds available in hospitals when patients need them, and patients are able to be discharged quicker. And there's been a number of reasons why that's all come together. Firstly, the hospitals said to me that the extra funding for this winter, about £2 million each, that both Eastbourne and Brighton got, made a huge difference in being able to pay for extra staff and open up and keep open those community beds in Newhaven, for example, to enable people to be discharged from hospital, but have some respite and some convalescence care before they go home. And that also made a big difference and enabled discharges to be speeded up, but people to still be able to be discharged safely. They also said that better working with the local authority, so East Sussex County Council and Brighton and Hove at the other end, made a big difference. And so joint working with social care and the health service is happening in Sussex. It's not happening all over the country, but it's happening in Sussex, and that's why we saw such an efficient and good response to an 11% increase in the number of patients attending A&E, which is huge, and which is on top of an average 6% increase each and every year. So our NHS is seeing more patients. So when constituents say to me, why are we facing these winter pressures? And the old answer you often get is because there's not enough money. Actually, there is money being pushed into the health service. There's extra money when the service needs it. There was £6 billion given in the budget late last year. So there is money going into it, but there's a sheer number of increase in demand. 11% just over this winter alone will make any service struggle. So we've got a lot to be thankful for locally, that the doctors, the nurses, the ambulance staff, the hospital managers, our local authority in East Sussex, care workers, all work together to ensure that we didn't experience some of the circumstances that we saw up and down the country. And it is about joint working. As the local MP, I will do everything I can to get the funding and resources that both our NHS and social services need. But we are a good example of how it can work. And I just want to thank all the NHS staff and all the local authority staff who worked so hard this winter. I'm there to support them and get them the resources they need. But the fact that we didn't see people queuing up in corridors or ambulances queuing outside the hospitals is down to their hard work, and I thank them for it.